Hey, this is Dr. Brian Mowll, the diabetes coach. I'm a master licensed diabetes educator, a diabetes care and education specialist, and IFM certified in functional medicine. I help people to reverse insulin resistance, type 2 diabetes, and high blood sugar by helping them find and fix the underlying root causes. In this video, I'm going to be talking to you about the worst dietary advice that is often given to people with type 2 diabetes and high blood sugar, and why it could actually be keeping your blood sugar high and making you more insulin resistant. Before we dive into this topic today, I just want to remind you, please give this video a thumbs up if you enjoy it, subscribe to my channel, and click that bell for notifications so you don't miss any of these informative, helpful, and powerful videos that I'm releasing for you. I also want to let you know that I have a free gift for you. If you look down in the description below this video, you can grab a copy of my blood sugar manifesto. It's a PDF guide. It'll help you to address high blood sugar and optimize your metabolic health. So just click that link down there in the description and grab a copy of the blood sugar manifesto. All right, let's dive in and get started and talk about the worst dietary advice that I often hear. I've been practicing and helping people with type 2 diabetes and insulin resistance for almost 25 years. And this is something that I continue to hear all the time, and that is to eat frequent meals throughout the day. Instead of eating 2 or 3 large meals, to eat every 2 to 3 hours to keep your blood sugar stable. Where does this come from, this horrible dietary advice? And I'm going to explain to you in just a few minutes of why it's such bad advice. But where does it come from to begin with? It comes from several things. Number one, the idea is if you eat throughout the day small meals, you'll have a constant or continual source of food, so your blood sugar will never go too high or too low. And while in theory that makes sense a little bit, it really doesn't work in practice. The second main reason for this advice being given by dietitians and doctors, well-meaning, by the way, I mean, they really, I think, want the best for their patients, is they don't want your blood sugar to drop too low. And what's the number one reason for dangerous hypoglycemia or low blood sugar? Medication. Now, it's sometimes described that it's because you skip a meal or you exercise without eating, but that doesn't drop your blood sugar into a hypoglycemic range for someone with normal metabolic physiology. But if you're taking heavy doses of medication to bring your blood sugar down, and you skip meals, and you overexercise without eating, and one of those medications has the risks of dangerous hypoglycemia, then it could bring your blood sugar down too low. And of course, doctors and dietitians want you to avoid that. So instead of helping you to really optimally manage your blood sugar with a good diet and lifestyle program, they'll just tell you to eat every couple of hours to minimize that risk of a low blood sugar episode. All right, so what are the problems with that advice? Well, we have to look at our metabolic states. We have 2 metabolic states. We have the fed state or the absorptive state, and then we have the fasted state or the post-absorptive state. These are metabolic states, and our hormones are drastically different. So during the fed state, we release insulin, which causes us to put glucose and other fuels into storage, into the muscles, into the fat cells, and we suppress glucagon, stress hormones, and other hormones which tend to raise blood sugar. And the purpose is we want to use the fuel that we just consumed, and then we want to store whatever is excess or left over. When we shift into a fasted state, the opposite happens. Insulin levels drop, glucagon starts to rise. We start to liberate energy from storage, pull fat out of fat cells, sometimes pull glucose out of the liver to burn for fuel. And so we're burning stored energy in that case. And of course, that's what we really want to do. We want to burn our stored body fat. We want to burn through our stored glucose, which is in the form of glycogen, so that we have room to store new glucose when we eat it, so that we burn fat, so that we are metabolically flexible and we have a high energy flux, energy flowing in and out of storage. The only way to do that is to shift from one metabolic state to the other. If you eat every 2 or 3 hours, you are going to be in the fed state, in that absorptive state, all day long. You'll actually never move into the post-absorptive or fasted state. And so you never see insulin levels drop, glucagon levels rise. You're living off of the food you're eating rather than your stored body fat and stored glucose. It leads to this energy abundance where we've always got this excess energy floating around the bloodstream, and that eventually leads to an energy toxicity, which is basically what causes insulin resistance in type 2 diabetes. So I know you've been told over and over again, eat 5 or 6 small meals a day, but that is horrible advice if you really want to make a long-term impact on your insulin sensitivity and blood sugar control. So what's the solution? What's better advice to follow? We recommend following something called Eat, Stop, Eat methodology, where you get all your food in at each meal within 1 hour. You can eat 3 meals a day. You can eat 2 meals a day and do some time-restricted feeding. I've got lots of other videos about that. That is less important. What's more important is that you eat all your food within 1 hour, and then you stop eating for at least 4, 5, or 6 hours to give your body a chance to get into that fasted state. And then when it's time to eat again, you get all your food in within an hour, say 12 to 1 or 1 to 2. You stop. You give your body a chance to get back into that fasted state. Then you eat again. And then you have a nice long overnight fast. So you can do your first meal at 7 or 8 a.m., second meal at noon or 1, third meal at 6, something like that, and get 3 meals in, or you can just do 2 meals a day. That's fine. Some people do 1, but I don't think that's an optimal strategy. I think either 2 or 3 meals a day. And then what do you do between those meals? You don't eat anything. No solid food, nothing caloric. You can drink coffee, you can have some water, of course, but you don't want to be eating anything that is going to put you back into that fed state. So remember, your goal is to allow your insulin levels to come down, your glucagon levels to increase, so you start to become more insulin sensitive. We want to shift body composition, burn through stored body fat, burn through stored glucose to allow the body to become a glucose sponge and a fat sponge when we eat. In addition to this, there's been some studies which have shown that snacking or eating between meals can be problematic. It can have negative outcomes when it comes to body composition and weight loss. There is a systematic review in 2017 by Sayer et al. That looked at 16 different studies and again showed that people who snack tend to have a negative impact on body composition and have a harder time losing weight and getting fat off. They also tend to eat more volume of food throughout the day, had a higher energy intake, meaning they ate more energy-rich foods like high-energy carbohydrates and fats, which negatively impacted their body composition. Another study published in 2020 in the Journal of Clinical Endocrinology and Metabolism showed that snacking or eating between meals had a negative effect on glucose tolerance and insulin sensitivity. They found that snacking led to higher overall blood sugar levels and impaired insulin response, and concluded that eating less frequently, less meals a day, led to better outcomes when it comes to blood sugar and insulin, when it comes to blood sugar and insulin sensitivity. So here's the bottom line. You're going to hear this advice. You're going to be told to eat frequent meals throughout the day. Don't listen to it. It's bad advice, probably some of the worst advice you can be given if you want to improve your blood sugar and insulin sensitivity over time. You have to let your body get into the fasted state multiple times a day, shift metabolic states. So remember, eat, stop, eat, stop, eat, stop. That eat, stop, eat methodology will really help you to become more insulin sensitive, burn more body fat, utilize the glucose that's stored in the liver, and the muscles when you exercise so that you can then refill those areas when you eat so you don't have a high blood sugar after meal. And I think you'll find over time that'll make a huge difference when it comes to reversing insulin resistance and ultimately type 2 diabetes and optimizing your blood sugar. Okay, it's Dr. Brian Mowll, the diabetes coach. Remember to like this video, subscribe, click that bell for notifications, and go down into the description of this video and find the link for the Blood Sugar Manifesto. Click on that, grab a copy for yourself. It's a quick read, and it's jam-packed with really good practical advice to help you optimize your blood sugar. Hey, thanks for watching. Have a great day, and I'll see you back on my next video.